Hello and welcome to the three-part video series on partnering to improve diabetes management, presented by Superior Health Quality Alliance. This recording was developed for healthcare workers with an interest in providing care to individuals with diabetes. In this second video, we will address the importance of diabetes patient education. You may watch each video in order or based upon your interest. The objective for this learning session is to achieve the following: review comprehensive patient education programs and best practices to help patients acquire the knowledge and skills needed to manage their disease effectively. So let's start with the session by reviewing the definition of diabetes self-management education. It is the process of facilitating the knowledge, skill, and ability necessary for diabetes self-care. The key here is that it is a process. It's a process of providing personalized services and teaching patients practical skills to fit diabetes into their daily lives. Let's start with the recommended position statement from the American Diabetes Association, or ADA, regarding diabetes management. The ADA recommends starting treatment of diabetes at the time of diagnosis. Why? Because we want to prevent the patient from developing kidney disease, heart disease, or many other complications that diabetes can cause. It's about proactive care, especially in the value-based managed care environment we're in today. The goal of the ADA position statement are to improve the patient experience, and patient experience encompasses the range of interactions that patients have with the healthcare system. So this includes care from their doctors, nurses, hospital staff, physician practices, and other healthcare facilities. We aim to improve patient education so they understand what they're dealing with and the potential complications. By reducing these complications, we can reduce diabetes-related costs, resulting in the patient having a better quality of life. There are two main programs, DSMES, which stands for Diabetes Self-Management Education and Support, and another DSME, which is essentially the same but emphasizes the education portion. What does DSMES do for a patient? Well, the program helps people with diabetes improve their health by providing personalized services. The foundational elements of the program include knowledge, providing them knowledge about diabetes and the effects it can have on their body. Development of the skills and ability needed to manage their diabetes. And development of coping skills and behaviors. These are all important elements. Unfortunately, enrollment in the program remains low, related to lack of knowledge about the program by healthcare providers. The guiding principles of DSMES are to give people with diabetes the knowledge, skills, and confidence to accept responsibility for managing their disease. This includes engagement with their healthcare team and their peers who also have diabetes, and this allows for information sharing. DSMES provides both psychosocial and behavioral support. A popular aspect of the program is the integration of other therapies, such as medical nutritional therapy, which we'll discuss later. And maybe the most important thing is how the program provides coordination across specialty care, facility-based care, and community organizations. So what are the benefits of DSMES? According to data from CMS and the ADA, this program reduces hospital admissions and readmissions. For example, a patient who is not getting support on managing their diabetes may become hypoglycemic, which then can lead to diabetic ketoacidosis, a medical emergency that requires hospitalization. If the blood sugar levels get too high, it can cause damage to the patient's heart and kidneys. And DSMES can reduce lifetime healthcare costs by empowering patients to manage their blood glucose levels, thereby preventing the risk of costly complications. Improved patient self-management also helps slow the progression of the disease and improves their psychosocial well-being and quality of life. It encourages physical exercise and promotes healthier eating routines. We also see here the reported outcomes related to time spent with a diabetic educator. It is projected that by 2050, 1 in 3 individuals will develop type 2 diabetes. Currently, it's 1 in 4, so the trend is worsening. At this rate, the U.S. healthcare system will not be able to afford these costs unless prevalence rates and diabetic complications are reduced. The DSMES program also includes education for providers, such as how to establish a referral network and how to empower diabetic patients to access the program. And finally, on the importance of follow-up. The program also provides telehealth services. So for patients who don't have transportation, telehealth can really help. Patients can get the assistance they need right from home. Recent studies show only 27% of providers are even aware of the program, which few patients know about as well. We're excited that DSMES now includes medical nutritional therapy. Medical nutritional therapy provides nutritional support and services delivered by a registered dietitian and nutritionist, which can save a provider time in finding one. All that's necessary is to make a referral for the patient to access this service. We need to help and educate patients about this program and then ensure they have access to the services requiring a referral. We have created a list of tools and resources that you may find helpful, and we encourage you to explore them further. If you have any questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.